that in many ways what we're talking about in this course is the science of the whole. That sounds strange. We think of the world as something where if we understand how particular pieces work, then by extension we directly understand the phenomena that we see. Much of science has traditionally been conducted in what's called a reductive fashion. By reductive, I mean it takes things apart, studies those pieces, figures out how they work, and that sheds light on, is believed to shed light on sort of substantive understanding of how the world operates. So we understand the pieces, the thought is by extension, we understand how things work. But in recent decades, people have realized that there's a real gap there. Understanding how the pieces work does not let you immediately understand the higher level phenomena. Understanding how cars work doesn't immediately help you understand why traffic jams form in certain parts within a city. Understanding how a computer server works doesn't help you understand patterns of timeouts you see when serving up videos on a very large-scale system with bursty accesses from all over the world, over the web. Understanding human biology doesn't give you a really great understanding about why we see certain types of infections like H1N1 shifting year to year, and what sort of strains they have and where it lives during the summers, not during flu season. It doesn't help us understand to the point of knowing who to vaccinate before whom. To really understand those phenomena, those collective phenomena, it's more than about the pieces. We need to be able to articulate and talk about and reason about the behavior of sets of things together. We need to be able to talk about the connections between things, the interconnections, and not merely the pieces themselves. This is not flawed. This is a realization that was a long time in coming. And the issues is, and one of the biggest issues is the tools for allowing us to do this analysis, this reductionist study, are very different from the tools of understanding how these pieces work together. Traditionally, if you look at domain after domain, statistics has been very widely used to sort of summarize aspects of the pieces, and the scientific method in terms of basic science has been used to study the pieces. But to really understand how they work together requires simulation modeling. Okay? If we look at the world more broadly, there's many areas where it's really difficult to make effective decisions. You may think computer systems, those of you who are third or fourth year computer science, you may think that computer systems are something that can be, can be understood in a fairly straightforward way, and then by extension, you can build up larger scale sets of computer systems. Well, it turns out that building a system like Google's farms to handle queries, that handle your Google queries every day. You go to Google and you hit it and you ask certain queries. Building up a set of servers to answer this efficiently and reliably with high availability. In other words, you're very, very likely to be able to answer that question. You have short latency. It gives a quick response. Turns out that that's a whole art in and of itself. There's a lot of unexpected phenomena there. Corporate strategy. If you're running a business and you're trying to figure out what products to invest in, how to roll those out, how to interact with potential competitors or potential partners, turns out that decision making there is really challenging. Even things like ordering policy. You think you're getting low on stock for something, you just place more orders. It turns out that a lot of interesting phenomena can come about, and sometimes you can get in situations where you have wide swings in your inventory. You either have feast or famine. You have so many things in inventory, there's no way you're going to go through them quickly, or you're just totally out. Municipal planning. Okay, so city of Saskatoon, and you're trying to alleviate traffic congestion in the city. What do? There's some very non-obvious things there. You put in a new road. Sometimes putting in a new road makes the congestion worse. That's a puzzling thing, right? You think, well, more road area, people have more choices. You know, it takes cars, it should decongest things, take cars from one place, put them in a place where there's fewer cars. You add a lane to a highway, you add a new road to connect A to B. You might think, well, automatically it should improve things. Well, it doesn't. Sometimes it makes it worse. And effectively understanding this requires the sort of simulation analysis that we're talking about. Managing an industrial power plant, doing project management. Has anyone in here taken my 371? Okay. Yes. Welcome. Good to see you again. Project management is one of those areas where we in computer science, particularly in software development, run face-to-face into this issue of what I'll call dynamic complexity. These situations where we have behavior that's hard to anticipate, and it's hard to make effective decisions because there's many uncertainties for sure, but there's also just great complexity in what will be the reaction of the system to our choices. So, for example, if we institute additional peer reviews in software, so we do more quality checks, at the first base of it, that might slow things, you might think it slows things down. We're taking people's time away from coding, and now we're having them look over other people's code. I mean, taking them away from coding, is it going to slow things down? Well, it's not nearly that easy, because if they look at other people's code and they find bugs, that may shorten the time spent in debugging and shorten the time spent in testing. It may also share knowledge, which allows other people to work more efficiently. So project management is one of these areas where, whether it's in software or in construction or many other areas, including health, where people have applied computer simulations to gain insight because of these complex phenomena. Healthcare policy is one, and broader health policy, public health, and healthcare operations. These are all areas where it's challenging to make effective decisions. And what unites these, ladies and gentlemen, is the fact that for all of these, the behavior of the whole system, whether we're talking about a hospital or whether we're talking about a system of companies that are interacting, or whether we're talking about traffic across the city, the behavior of the whole is greater than the behavior of some of the parts. A city is not merely a set of roads from the standpoint of the behavior of traffic across the city. You can't simply total up the amount of roads and come to a decision about how bad the traffic situation will be. There's all sorts of interactions you need to understand in more detail. And when we have situations which exhibit this sort of complexity, where these interactions end up making such a big difference, we get situations where our choices end up coming back and biting us sometimes. It leads to what's called blowback, a situation where we may undertake an action which we think is going to help, and we hurt things. I can rattle off cases for this. In software, you're talking software development, there's Brooks' Law. Does anyone in here know Brooks' Law? Named after Fred Brooks in the 1970s? No? So what he said was this. If you have a late project, adding more people to it makes the situation worse, makes it later. That's a striking statement. Adding people to a late project makes it later. For instance, adding more hands to the project, more people to work on it, and get the work done more quickly. How could that be that it's going to make it later? Anyone? Getting people up to speed. So, and who's going to get them up to speed? Often it's the most experienced people, right? So you're taking taking those people away to train these. So that's part of it in the short term. Others? Yeah, so there's the teaching, and during that time there's going to be lower quality because, you know, the people won't be able to produce as much code, but the code they produce will be less high quality as well. There may be more bugs in it or more problems that go back and be fixed. So that's part of it in the shorter term. There's also generally more coordination needed. Now you've got to divide up this work among more people. And those people have to talk. The interfaces between those people grow in number. You go from 2 people to 3 people, there's a lot more connections which have to happen. You go from 1 to 2. I mean, that itself, you're doubling, you know, the number of things. What used to be in your head is now involves a different person. You go from 10 to 20, it goes up with a square. N squared, or N is the number of people. So that's one area where we get blowback. Another area we get blowback is in the health space. Time after time in the health area. We try to fight a nasty microbe by using a new set of drugs, and what happens? We get resistant. You get antibiotic resistance. And now we have to search for a whole new class of drugs. It's a lot of expense to try to fight it, and it becomes a lot more complicated figuring out what we can give to a given person. Happened with behavioral risk factors, smoking. You know, there was a move to low tar cigarettes in the 1970s. The idea was, well, look, smokers, if they're going to be smoking, let's give them cigarettes that do less harm. Let's give them cigarettes with less tar on them. How could that be bad? They're less exposed to cancer-causing compounds. Isn't that good? What do you think could happen? Yeah. They smoke more, they quit less. And that's what a lot of people did. Instead of quitting, they switched to low-tar cigarettes. They would have been quit. They would have quit. But they said, oh, you know, there's a more healthy option. I don't need to quit. Switch to low nicotine cigarettes. That was a big rage too. Switch to a low nicotine cigarette. Like low tar cigarettes, this is viewed as a failure. And a very expensive failure. Expensive not only in terms of cost, but in terms of lives, ladies and gentlemen. Why? What happens if you have low nicotine cigarettes?
Could you say that was a massive success, getting more people to smoke? I mean, it's depending whether you're a health official,
okay.
Whether you're
I'm talking from the perspective of the health official. Yes, we do have people in the tobacco side who are interested in using simulation models for investigations from their side. But you're right, there's a normative judgment there, and I'm speaking from the perspective of the healthcare system, because it's the healthcare system that's bearing the cost, among other things. So lower nicotine cigarettes, people smoke more of them, get the same buzz, smoke more cigarettes. So, you know, that's another area of blowback. But that's not alone. You mentioned one earlier. You put in a new street, slows down the traffic. Corporate strategy, we have many cases where a company ends up flattening its back because it undertook something that wasn't clearly enough thought through. You get these counterintuitive results to choices made at any number of different levels in any number of different areas. And again, the theme here is that the whole is greater than the sum of its parts. And if we don't understand it, if we don't understand how the system works, that's an operative term I'm going to come back to many times. If we don't understand how it works, we're not going to be reliably able to anticipate how it will respond to our choices. If we just look at statistics on the connection between this and this, the association between, you know, amount of roads on the one hand and traffic congestion on the other. If we look at traffic congestion over time, the amount of time spent waiting in traffic on the other. If we look at statistics on bug rates in our project or what have you, that's not going to get us very far. What we need to do is understand something about how it works. And the problem that a lot of traditional teams fall short in is capturing this phenomenon of emergence. The patterns that we see from systems that we're working with as a whole are often very different from the patterns we see from any one component of the system. Okay, and this is what I'm saying about the whole being greater than the sum of the parts. So with traditional approaches, which have pursued a reductionist strategy, they've gained a lot of insight. A lot of understanding has come by understanding the pieces. But it's not complete until you understand how their connections end up impacting the behavior as a whole. It's not all just about the pieces. It's about the whole. Domain after domain after domain. So, we can understand in detail how a server, a router, any network connection works, but adding one may dramatically alter the performance. We may see, and by the reverse token, if we eliminate something, if we swap in a server for another, we may find suddenly our performance goes to all hell. We have a few more customers coming to our site, our website, our web application that we built, and suddenly they're getting timeout errors and we're scaring them away. So, to understand phenomena like this, to understand these effects on the health side, to understand the effects in areas of planning, etc., we need to grapple with this fact of these sort of challenges of complexity. Situations where we need to understand how the behavior of the system as a whole is resulting from its pieces, in a way that isn't simply adding up our understanding of the pieces, but is understanding their connections. So these are a variety of challenges that come up. Counterintuitive behavior, it responds in ways we don't anticipate. There's misperceptions of what's going on. The same set of data, you may be able to interpret in two very different ways. One that's very positive and one that's quite negative. And without reasoning about what's causing this data, what's giving rise to this, you're not going to be able to distinguish those. Policy resistance. Cases we undertake an action, we think it's going to help, and it ends up blowing back in the face. There's also cases, though, where a small investment can yield a huge return sometimes. Cases where we make just one extra little bit of contribution and the situation changes for the better. This is what's happened with certain childhood infectious diseases for many decades. That's why when many of us were growing up, we weren't every year getting exposed to, or every few years getting exposed to really major outbreaks of things like chickenpox or measles. You can drive these things to virtual extinction if you know their weaknesses. And if you can identify that tipping point, it lets you know how much to vaccinate, for example. The problem is, if we're facing these counterintuitive issues, that poses problems for a lot of traditional techniques. If we don't understand where this policy resistance is coming from, we don't understand really what's going on, we have problems learning from our experience, problems coordinating our different actors within the system, problem deciding what to do, and problems in terms of designing. If you're designing a server farm, how many servers do you need to handle that bursty traffic? How do you handle the fact that people out there who are your customers talk to each other? And that may yield benefits in the sense that more of them come to your site in bursts because it's just been tweeted to a bunch of people and people come to your site at once. Or it may happen that one of them gets a timeout error, says this site is for the birds, and they tell other people and you lose customers. How do you design effectively your larger system, whether it's the health system or whether healthcare system or whether it's a system of servers, so that it captures the type of behavior with the appropriate costs that you're talking about. So some of you may be familiar with Far Side cartoons. I always like this one. So here we've got this Viking boat, and they've got a situation where they have a heterogeneous mixture of people aboard rowing this boat. So on the one side, they've got some heavy hitters And on the other side, they've got some folks who look like they're coming out of the computer labs here. The point here is that you would think that adding these heavyweights over here on the right-hand side, that's going to help things, right? You're going to have more people pulling at the boat. But the issue here is not an issue of only how much pull do you have on the boat. There's also a systems issue. What's the relationship between these? And in this sense, in this case, you've got all these guys on the right-hand side, and they're making the boat go around in circles, of course. So they've taken away from even the benefits these guys would have had, the computer science folks, on their own. Okay, so we talked about some of these effects. In computer science, there's a number of names for them. I mentioned Brooks' law before, Metcalfe's law. Value inferred by a network goes up with the square of the number of nodes. You add one computer to a network, the value conferred goes up proportional to the number that are already there. Yeah?
What do you mean exactly by value conferred?
The value to the users. How much value they secure. So this is actually Bob Metcalfe's to make sure that with a network, if you look at the extra benefit that someone gets from a network. Does anyone know who Bob Metcalfe is? He's one of the more famous names in computer networking. Yeah. Inventor of Ethernet. What is Ethernet? Yes, local area network, RJ45 cables, folks. This guy here. So he wasn't around with RJ45 cables at the time, but he was using coax. But he invented one of the earliest and now the most widespread wired computer network. And Bob Metcalfe was around at a time where networks were in their infancy, and companies were thinking about, should we install a network or not? And, what he reasoned about, it's kind of like a subway system. The value of a subway system is very limited if there's one stop, right? The more stops you have, the more flexibility you have in where you can go, the better. And similarly with networks. If you have one person in a network, it serves no purpose. If 2 people, hey, that's great. 3 people, well, each of those people now has the option to send mail to the others. And so for each person, the sort of benefit, the level of benefit rises proportional to the other people in the network. If we want to quantify it, as we often do in modeling, one way you might quantify is, well, how much money would they pay, to be part of this network? I can tell you, if you made an offer to someone, okay, you can be on this network with 5 other people or with 500 other people, you'd probably be willing to pay more to be in that larger network. Okay. So good question. Well, I mentioned policy resistance there, and some of you who are from the health background may find these sort of interesting. There's just case after case of these sort of issues. So I was going to mention some issues in the health sphere, and I will just mention, if you look at, this is kind of an interesting little case study. If you look at spread of infectious diseases, this is actually a graph showing chlamydia cases in Canada. This is from Public Health Agency of Canada. This is the number of reports of chlamydia within Canada, shown in bars here, over time, 1991, 92, 93, 97. So you'll notice that after an initial jump here, it went down. And there's a lot of patting on the back that went on in those early years. We thought we really had this thing on the run. Does anyone know what chlamydia is? Yeah, it's an STD. It's actually transmitted infection, and it's actually other than HPV, it's the most common, most prevalent here in Canada, and people thought it had it on the run. This decline was a result of a lot of heavy effort for people to try to reduce the amount it spreads, and this was all sorts of techniques to try to reduce spread, use of condoms, education, lots of efforts. And they thought they had it on the run. And of course, what happened is something like this, a rebound. Now, this rebound occurred in the number of cases, and by the time you reached about 2006, people were talking about a crisis of epidemic proportions. You know, a disaster. We're in a terrible bind. The number of cases of chlamydia has just been going up and up and up, and we are, you know, we're facing a public health disaster in terms of the spread of this illness and in terms of the suffering that it causes. Now, if we want to understand why this is, or in fact, is this even a good thing, we have to look deeper. How could it be a good thing? How could a rise in the number of chlamydia cases be a good thing? How could it be good that we're having this more and more reported cases? More number of detections. Maybe this isn't more spread. Maybe it's we're actually catching a larger and larger set of people who are ill. Could that be good? Yeah, it could be. You're draining the. It could be good because you're draining the swamp, right? It may not look good from the statistics alone, but again, this gets us to the limits of the statistics. We need to start reasoning about what's going on under there. What's happening? What is driving this? How is the system working to give rise to this behavior? Is this the result of, oh, we have more cases this year, let's do more testing because it's more and more common? Could that be it? Or is this, it's spreading among people faster and faster because more and more people have it? In either case, it's a systems effect. There's a feedback involved. A virtuous cycle or a vicious cycle. Situation where more chlamydia means more new infections and more chlamydia yet. On the one hand, virtuous cycle. On the other, a virtuous cycle where, you know, we see all, you know, additional cases. We know there's there may be more of it out there. Let's test more, and you've got it on the run. You're treating more and more cases to fight it. Understanding, however, these patterns requires understanding a lot of complexity. You think about something like obesity, all these different levels of analysis. And people have mapped out whole systems using systems thinking techniques. This is kind of a weaker form of systems thinking, which just diagrams in a qualitative fashion how things are linked together. And we'll see how even a diagram like this, with just a little bit of additional quantitative information, readily, easily associated with it, can yield a lot of insight about why we see certain types of behavior. But there's also certain behaviors that come out. So people in the 1700s started to notice patterns associated with infectious disease, this so-called bell-shaped curve associated with spread of, in this case, it's deaths from bubonic plague, the Black Death in London, and this is the number of deaths over time. Why do we see that pattern? Is there something about the Black Plague, something about this organism that has, you know, is this the shape of the organism? No, it's nothing to do with like that. It's a higher level phenomenon that results from not only from the organism, but how people mix and how they respond when there's risk around them. It has to do a lot with how many susceptible people are injured and how many, and to what degree can the infection keep spreading if it's the number of susceptible people around is lower. We're going to see that. This is for childhood infectious diseases. You have these spikes and then periods of stasis spikes. This, ladies and gentlemen, on the left is from England and Wales. This, ladies and gentlemen, on the right is from our home province, Saskatchewan, for measles and mumps. These sort of systems are associated with tipping points. If you can get to that point where certain key points, you may be able to totally turn things around. We see this with software projects, ladies and gentlemen, all the time. I've seen it personally. And it can cut both ways. A project that's in great shape, high morale, high retention, keeping the good people, people's morale is high, they're willing to bear with the occasional blips that come up, they're putting out high quality code, they're putting their heart into it, because you're keeping the same people over time, a lot of it is in their head. They're able to work with little in the way of formal documentation, so the documentation burden is small. And they're building a really high quality system, something they really believe in. Very enthusiastic about it, and they attract good people. High morale, good people retained. Quality of the code is excellent, the customer is very happy. How can it be that that same team, same people, in another circumstance, is stuck in a vicious cycle? A vicious cycle where the code base is low quality, the morale is low, they're losing people because people don't like to work on systems that are really low quality. They don't like banging their heads against it. It's going from crisis to crisis to crisis because there doesn't ever seem to be time for risk management because you're always fighting fires, and so you don't have time to prevent fires from happening. And you've got a inability to attract really, really good people. You're always training new people who don't know how things work, and the code base is so messy now because it's been worked on by so many people that they're just not sure what to modify. And you have a situation where the project's stuck in this vicious cycle. Same basic people, but now with just terrible turnover associated with them. Night and day. And if you don't believe that these extremes exist, you've got to think, I've seen it. I've seen it in my consulting practice. I've seen it about teams that I've been in. Gelled teams, fantastic morale on the one hand, teams that are falling apart on the other. This is all about tipping points, ladies and gentlemen. Going from that virtuous cycle to that vicious cycle, or vice versa. It happens very quickly if you get the system to a certain point, because it begets itself. These certain tendencies reinforce themselves, etc. And so, if we can judiciously know, where that tipping point is and can nudge it there, we can have a disproportionate impact. Some of these phenomena, on the other hand, have to do with structural complexity, sort of positioning of people between communities. This may be communities, this city and this city here in Saskatchewan, this small town and this city, and this is someone going back and forth who brings H1N1 to the small town. But this could just as easily be two companies, and this is a highly paid consultant, and it's someone bringing ideas back and forth. Or maybe this is the university on the right, and maybe on the left we have a company. And this individual is serving as an intern in the company and is bringing ideas from the university lab to the company and other needs back to the university. This individual maybe have disproportionate value that they're bringing to the system in terms of innovation, for example, because of their position in the network. This position in the network may afford them a certain impact that far exceeds what you might think from thinking of them as a single individual. And we see this all the time in real-world data for things like TB here in Saskatchewan. This is from TB in Saskatchewan. These are individuals in different communities, for example. And here you are bridging individuals. This is from 11,000 person network here in Saskatchewan, showing individuals associated with TB cases and TB cases themselves and bridging individuals. We have situations where we have great heterogeneity. Situations where and the interesting thing here is, okay, yeah, so it's an obvious fact, people are different. What's the big deal? The deal, folks, is that a small number of people or a small number of components in your computer network may have a far disproportionate impact. The tail can wag the dog, folks. It's not the number of people. It's often something about their role in the system. And if we talk about an infectious disease, and the same ideas hold for spread of innovation, or spread of memes, or spread of rumors, and so on. if we think about individuals of lots of connections, maybe this is someone on Twitter with lots and lots of followers. Maybe it's a website with tons and tons of traffic coming to it compared to other sites. But maybe it's a person, as is here, with large numbers of sexual connections over the course of a year. We may have very few of those people. Look, this is a graph showing the relative frequency for men and for women of different numbers of sexual partners within a year's time. And, you know, out here, in the 20s and 30s, we may have very few people. But those people are hugely important. Why are they hugely important? Someone out there, give me one reason that someone with a lot of partners, if we think about an infectious disease, I don't care if it's sexually transmitted infection or needle-borne infection or if it's flu or whatever. Why is it that someone with a large number of connections can be so important? Yeah, and why does that matter? That is two different things.
They bridge gaps between the ones that are paired.
Okay. So let me put it this way. So that's true. So they're linking up whole communities. So I like that. Another reason is that person is more likely to get infected than anyone else, right? They have lots of, so if someone else there is infected, they're more likely to pick it up. They're like a magnet for infection, right? And if they get infected, they're more likely to spread it to many other people as well. They're more likely to disseminate it, to spread it. So they're more likely, they're more important for those two reasons, which are a little bit different. More likely to get it in the first place, more likely to spread it in the other case. Why is this important? Because sometimes we have limited budget, we have limited time, and we have to pick a small number of individuals we can affect. On the health side, this might mean treating a small number of people. We can get huge bang for the buck by treating people like this because they have this disproportionate impact. But this has nothing to do inherently with purely health. If we want to influence, you know, if you're a marketing company, you want to influence people, or if you are a company that's interested in stimulating technological innovation so that you can sell more product or what have you, lowering the barriers to your product getting into the marketplace. Knowing about certain of these key individuals can allow you to put much more effective emphasis and get more done for limited resources. So, again, application area health, but we're talking about phenomena that transcend health. And so the deal here is that don't get distracted by the norm. Don't think that somehow just by, you know, talking about the normal individual, the typical individual, that you're going to be able to reason reliably about this. The system's behavior may not be driven by the typical individual. It may be driven by a certain subset, small subset of individuals that are unusual or have disproportionate impact, okay? It's also a set of spatial phenomena that we'll be looking at here again. Chlamydia, rabies spreading spatially in sort of circular type patterns. Oh, transmission of bubonic plague. That's an interesting one. Now, I'll just close with a few words here. The emergent patterns we see, whether it's this the spread spatially, whether it's aspects of spread in terms of networks, etc. Fundamentally, what we're seeing is things which reflect aspects of the systems, interactions, delays, feedbacks within the system, vicious and virtuous cycles I mentioned, factors that are nonlinear. We can't simply, to figure out the response to the system to two things, we can't think about those things independently. We can't simply total it up with a response to one and response to the other and expect to understand its response to both. There's a nonlinearity and there's heterogeneity. The idea behind system science is putting these pieces together, understanding the behavior of the whole and how it results from these pieces, okay? And the key way, one of the key ways, the most important way right now in which system science does this is through simulation. We build simulations that help us understand how the system works. That was depict and reason about, consistently about how the system works. And the deal here, ladies and gentlemen, is that we are at almost all times operating with models in our heads about how things work. But those models have their great limits. We're inconsistent. We forget things, especially when we get phone calls. We are not able to reason quantitatively in a way that is nearly as powerful as what a computer can do. We have cognitive dissonance. We sometimes believe A, and sometimes believe B, and sometimes believe both in some weird juxtaposition. So models, simulation models, provide us with a way of rigorously depicting how things work in a system in a way that's crisp, quantitative, and precise. That doesn't mean it's correct necessarily, but it helps us more quickly figure out if it is correct. It helps us more quickly figure out, is this likely to be the case? And helps us advance the discussion. It helps us more by being explicit. It helps us share that model, helps us share that understanding, helps us critique it and analyze it, and it helps us advance it, refine it further. Okay? So these models provide a way to characterize these systems, and we can think of them as kind of dynamic hypotheses. Hypotheses for how things work, and we can reason about the consistency of what we actually see with these hypotheses. And we especially do that to reason about counterfactuals, things that we don't understand. So we're going to be talking about a variety of types of simulation models that include networks and use state charts, which exhibit stochastics such as this, which depict spatial phenomenon, which depict phenomena over time. And we'll be looking at three major sorts of models. On the one hand, system dynamics models, depicting things as stocks and flows over time, mappable to differential equations. Agent-based models, where we have individuals placed in networks, etc. And situations where we have, do I have a nice depiction of it? Oh, maybe not. A discrete event model, where we have people flowing in, getting operated upon, for example, by different processes or cars flowing through an assembly line, and we're interested in how much certain resources are used, how much certain processes are exercised, etc. So we're going to be taking a look, starting next time, at some of these sorts of modeling. Probably what I'll be starting off with next time is a little bit of an exercise to get you some hands-on exposure to one of these sorts of models. And we'll then continue on a bit of background and transition to the first sort of model we'll look at in more detail, which is system dynamics. Okay? So that's all today. I appreciate your patience while I was getting set up here, and we'll try to make sure that I do a better job including my remote partners here. If people came in late, we have copies of the course outline up here, and I'd be glad to pass them out here. Okay, sure. It's good to see you again. Yeah. Hi.
My name is Kamal. I'm from the School of Public.
Yes, welcome, Kamal.
First of all, the totaling for the option 2 is not 80%. I think
God.
either of theirs that
Okay, thank you. I tried to catch that. That's for 858.
Yes, because I think that's the one I'm going to take.
Okay. Great, yes. Yes, you're welcome. So you work with Cheryl.
Yes, I work with the Cheryl, and it's going to be a part of my thesis project.
Great.
So I have a data set.
Yes.
And it's a longitudinal data. And in the fourth round, almost 50% of the people are missing.
Okay.
So what we want are
Yep.
interested to see is that if that data was not missing,
Right.
how would our results